Today's topic will be waterborne diseases and water-induced disease. There are two topics which they have given. There is a fine deviation. What is waterborne disease and water-induced diseases? Waterborne diseases, if any contaminants such as bacteria, virus or parasites, these are all called pathogens. These are all microbial things. If in water these microbial things are there, if you consume that, you will be ending up in some disease. That is called waterborne disease. Another title is there, water-induced disease. That means it might be due to some minerals. See, water might be good. It might not have any virus or bacteria, but it might have lead. Lead is a mineral. Arsenic is a mineral. These minerals are excess. What will happen if you consume that water? You will be getting hormonal damage. This kind of diseases will end you up in 1 week or 2 weeks. See, if you are having typhoid, I hope maximum students would have this experience of typhoid. It will last for 1 week to 10 days. After 10 days it will go. This is the reason. See, why do you get typhoid? Due to virus or bacteria. Typhoid is a disease caused by bacteria, not virus. This lasts for around 1 week to 10 days. After that it will vanish. This giardia, cholera, botulism and diarrhea, all the disease caused by waterborne will be longing for 10 days. After that you will not get any disease. But water-induced diseases, if you intake high mercury, see, mercury is a mineral. If you intake mercury-induced water, it will create your bone problem. The bone will not grow. If the bones are grown, it will be buckled. It will create permanent damage. You cannot recover from that. Can you recover from typhoid? Can you recover from fever? Yes. Bacteria, virus, you know, protozoa is also greater in size. See, virus will be much smaller. Bacteria will be much bigger than the virus. Protozoa is much bigger. What do you mean by parasite? It is also microorganism. Virus or bacteria can live in inorganic place also. But parasites need a human being or living organisms in order to live. So, waterborne disease is a microbial infection. Yes. Causes of waterborne disease. These kind of virus and bacteria can be transferred from untreated or contaminated water. Nearby some rural place, nearby their house they will be having sewage. Adjacent to that they will be having the water tap. What will happen? Automatically there is a high chance of contamination of water like this. And sometimes during a rainfall or during a flood, what will happen? That contaminate water, during a flood everything will get taken over. After taking over sewage water, this sewage water will mix into a river. This sewage water will mix into your well. These people will be consuming the water from the well. In rural areas, they will consume water for their daily households from the well. What will happen during a rainfall? All the sewage waste will be carried up into a well. That same water they will consume without their knowledge. That is why in rural areas they will be getting waterborne or water-induced disease in a higher level. Currently we are in Bangalore. We are getting only two forms of water. How we are getting? We are getting only from the Kaveri water or from borewell. There is no chance of getting contamination. But if you are living in rural place, you will be only living with river water. You will be only living with the well water. In those cases, this kind of disease can come. So leakage from the drainage system might happen, and flood and natural disaster, I have told, chemical pollution. Now, let me talk about each and every disease. First disease is cholera. So this is caused by vibrio cholera. This is a bacteria oriented disease. Have you heard this name, cholera disease? Frequently you would have heard. Severe diarrhea will happen and dehydration will be there. Next thing is typhoid. This is due to a bacteria, Salmonella typhi. What will happen? The person will lose 5 kg or 10 kg weight. From where it happens? The contaminated water. We will drink that. Due to this bacteria, it will live in your body. This is the microscopic image. Each and every bacteria I have referred, and this is the exact bacteria which while you are consuming, this is called typhoid, and this kind of bacteria is called vibrio cholera. Cholera will be like this in microscopic image. This will create fever and abdominal weakness. Next thing is dysentery. Why does this cause? This is also due to a bacteria, Shigella bacteria, and water contamination. Due to that only you will be getting dysentery. This is the Shigella bacteria. It might be consumed by a well water. Like this you would have consumed. So due to water there will be some problem. Next thing is hepatitis A and E. Have you heard this jaundice? Jaundice is a what kind of disease? Waterborne disease. Jaundice is caused by hepatitis virus. Typhoid is caused by what? Bacteria. And jaundice is caused by what? Virus. What kind of virus? It will be like this. So virus HCV. Lipop. What do you mean by lipop? Is lipoproteins. Your body or your eyes will become yellowish. Have you seen during jaundice? They will check the eyes, then only they will confirm. If it is pale yellow or yellow, they will confirm that hepatitis virus, and jaundice will be only due to drinking contaminated water. Nausea and fatigue. Next thing, polio. Have you heard this? Every born children will be having this vaccine, polio vaccine. For what purpose you are getting that is polio virus. Polio is a virus. This is a polio virus. What will happen? This will create permanent damage. When you are earlier, when you are in childhood, if you are not having this polio, this vaccine, the kid or the kids will be grown up like this. After you have grown, it cannot be recovered. The polio vaccine is most important vaccine during early childhood. Due to this, you will be having paralysis. Not only the hand, different types of paralysis is there. What are the different types? One leg, they cannot walk. So one leg might be having that paralysis, and like that in different parts, half of the body will get damaged due to that virus. Because when you are growing, as a child you will be growing, that virus will take care of certain parts and it will not be sending signals through nerves. So nerves will get damaged. Why does polio virus occur? Fecal or oral route via water. So due to water only you will be getting this disease. Next thing is Giardia. Giardia is a protozoa. Protozoa is much larger than bacteria and it causes diarrhea and abdominal change. And cryptosporidosis. This is a protozoa. Due to this you will be getting diarrhea and dehydration. Now first part I have told you nearly how many types of disease I have discussed. 5 types of disease. So these 5 diseases are purely due to waterborne disease. Now let me discuss in water induced disease. Waterborne and water induced. Water induced is due to chemicals or minerals, etc. So this is the difference. In short, water induced disease is chemical or physical contamination effects plus waterborne disease. This consists of both. It might be due to waterborne and this mineral or chemical contamination. So due to that you will be getting some of the diseases which I will discuss. What are the first diseases? Minamata disease. Who kept this name is from Japanese. Some names might be from Greek, which we can identify by their name. From Japanese or from Greek, from Korea, due to this the name of the disease will also come. Where is the origin of the disease? They will give the name of the disease. Coronavirus. Tsunami. Who gave the name of tsunami? Japanese gave the name. Why? Because they are severely affected with that. They are giving the name. So world over we are calling it as tsunami. So like that the name of the disease also from where it occurs. Where is the origin? Maximum where they get affected. From that the disease name will be there. This is due to mercury contamination. You will be living near some industrial area. In that industrial area, high amount of mercury will be exposed in the river. What they will do, the effluent, the industrial waste will be letted out in river. That same river water they will consume. This is called the effect, and you can see like this the permanent damage will occur. Itai disease. Itai disease is it hurts. Itai means in Japanese it hurts. It hurts, it hurts. So that is called itai disease. If you consume cadmium in a water, you will be getting this kind of bone damage. Bone pain or kidney damage will be there. If you are intaking much arsenic, skin problems will come. Even you might get cancer. Due to this problem will come. Fluorosis. Excess fluoride is another mineral. The reason for the disease is, you see, fluoride. Fluoride is a mineral. In paste you are having fluoride. Have you read that? What are the ingredients in the paste? Have you seen? There will be fluoride. Little amount of fluoride will be there. Due to fluoride, a disease will come. Due to arsenic, cadmium, mercury, these are all called minerals. So due to that, whatever disease we are getting will be water induced disease. So waterborne diseases, I have told you. Wash water diseases. Wash water diseases also I have discussed. Then next thing is water based diseases. Those who are working in the village, some farmers, maximum 6 to 8 hours they will be standing in the stagnated water. They don't know what is inside the water. They will be standing there and they will be working. So in the water you will be having this kind of small insects. So these insects will bite them, and these insects will get contact in their legs. So due to that contact they will be getting some disease. That is called water based diseases. Next one, factors affecting water qualities. Sir, why we are getting this much of effect? In the sense, due to geological factor we are getting the water problem. How does fluoride we will intake is, you see, there will be some industry, they will be letting out the effluents. So these effluents will be contained in clouds, and during a rainfall the high fluoride content rainfall will fall. This will go into groundwater. We will be consuming that groundwater. Have you heard about acid rain? Acid rain is what? More number of sulfur is concentrated as a cloud. It will fall. It will be letting into a sulfur rain. So don't think that cloud is always pure. If you pollute the air, that cloud will also get contaminated. Don't think that the rainfall 100 years before was very pure. Why? Because the clouds are getting contaminated. Whatever rainfall you get, that pollution along with that the rain falls, so it gets contaminated. Anthropogenic. What do you mean by anthropogenic? Is industrial effluents. The industry people, they let the water in the river, that same water we will consume. That is the reason. How many ways we contaminate water? In the single shot, one shot image you can get. First one is from industrial effluents. Next thing is, are we using fertilizers? Artificial fertilizers. What will happen? This fertilizer will be there in the soil. During a rainfall, all the rainwater will get penetrated inside the soil. Along with what? Whatever pesticides you spread, that same pesticides will go into the groundwater. So due to that it will get affected. Volatile things also due to natural calamity. What are they? Due to volcanic eruption. Don't think that volcanic eruption will bring only carbon dioxide. No. Multiple minerals it will let. It will let also arsenic, fluoride, mercury, number of minerals will be blasted, and all the clouds will be formed as a condensation and it will fall. Forest fire, etc. So this is called anthropogenic reason. See, you can stop these two. You can stop using pesticides, you can stop using industry. But can you stop these things? No. So how we can save ourselves is by using this above technique. Sir, you have told number of ways the water is getting contaminated. How we can take care of ourselves? The sense, first thing is safe water supply. When you are drinking, when you are getting contact with water, the water should be boiled. Chlorination. Have you seen this? Chlorine they will induce in the water. Next thing is UV treatment or RO purification. When you are buying some water, they will identify with a name, RO water, UV. The rate is also 25,000. If there is only less amount of filtration is happening, then that water filter will be 5,000. More number of filtration is happening, that means the cost will be high. You can do multiple form of treatments, then you can have the water. Now, sanitation and hygiene, yes. Vaccination, you should have vaccination for all this type. These are the virus. Any of the one form, if we intake, we will be getting that disease. So that for all the diseases, you have vaccinations. I hope minimum 5 to 6 vaccinations you would have had. Those vaccinations are purely for water-oriented diseases. Now, government programs, what they are doing? Jal Jeevan Mission. So, if you go in Kumbalgodi area or if you go towards this area, you have that Jal Jeevan Mission tap water. They supply. Government supplies. After making all the treatment only, they supply this water. So you can trust the government water, Swachh Bharat mission. So you can use this two water. Now this is a global and Indian statistics. WHO estimate 80% of the disease are water related disease. The cases will be there now in hospitals. If you go, how many patients came today? If they take all the patients history for what disease they came, 80% of the disease are related to water oriented disease, particularly fluorosis. In India, what disease is high? Fluorosis. Where in Andhra Pradesh and in Rajasthan, arsenic oriented diseases. Arsinosis in West Bengal and Bihar. Malaria and dengue is widespread. This is due to what? Mosquitoes. Can you see these people hand are highly affected due to skin cancer. They will be getting dark spots in their hand. Why? Because they are getting this kind of arsenic. This is due to arsenic problem. They might be working in the water for washing purpose. They might be washermen. Heavy contaminants will create this kind of diseases. Now, fluoride problem in water. How much fluoride content should be there? Excess of fluoride content which is greater than 1.5 milligram per liter. In 1 liter, 1.5 milligram is called excess fluoride content. Less than that you should have. If it catches you or if you are getting contact with this fluoride water, you will be getting dental cavities. Dental means teeth. Teeth problems will come. Yes, sources of fluoride. So these are the sources. Natural sources are volcanic, coal, etc. and anthropogenic or industrial smelting, etc. Now, what are the health effects due to fluoride is? Your teeth will get some problem. Have you seen the rural places? The people's teeth will be much dull. We will think that they have not brushed it daily, but they are brushing. What the thing is, their water is contained with fluorosis. What they will do is, when they consume, the teeth will get damaged. This is the first level. They have to be aware in that first level only. If their teeth is not pure or some dark patches are there, then you have to be careful in this first stage. Why? Because if your teeth is white, yellow or brown spots are there in your molting of teeth, then it is a problem of fluorosis. This is the first stage. Now, if you are constantly drinking that same water, what will happen? Skeletal fluorosis will form. After intaking that, it damages your bones. It affects your joint. Certain people will say that joint pains are there. In my hand or in my knees, there are joint pains. Even though I have not done any hard work, I am getting some joint pain. Why? Because due to this mineral intake. 50, 60 you are getting joint pain is okay. But 30, 40 or 20 you are getting joint pain in the sense somewhere due to this kind of mineral you will be getting this severe effect. Then next level is, in severe cases, neurological effect and kidney damages might happen. So this is due to fluorosis. In India, if you take, which state has most number of fluorosis damages? Rajasthan. Nearly 40 lakh people, not one or two. The cases they are monitoring, and you see Karnataka is in third place. Nearly 13 lakh 29,000 of people are getting affected, and top 10 states are there. Fluoride affected areas and 20 union territories are there. This is the map which shows which area is highly affected due to fluorosis. this Rajasthan place. These dark colors are not affected by fluorosis. Sir, how to take care of ourselves? Sir, this kind of diseases are there, problems are there. How to take care of ourselves? First thing, solution for fluorosis is, if you are living in a place where your river water is contaminated or well water is contaminated, first thing what you can do is Nalgonda technique. What do you mean by this technique is adding lime, alum and bleaching. These three if you add and you stir it, you see here 40 liters of water, it will be stirred and water to use. If any water is contaminated due to fluoride, you can do this treatment for a community level, and it might be done by some panchayat or unions. This is one thing. Next one is activated alum filters can be used. Alternative of safe water drinking purposes, best way is depending on rainwater harvesting. Why you are doing rainwater harvesting? Whatever water is falling on your house, you are storing that. When you are taking that same water from ground, your water will come. Imagine if you are taking water from an agricultural land that is polluted, that water will be infiltrated. If you are having that water, you will be also having a problem. So alternative safe is rainwater harvesting at your place. This is the best way. Nutritional interventions, this can be done, and government initiatives can be taken in order to prevent the fluorosis. Another thing is osmosis. What do you mean by reverse osmosis? RO water. What is meant by reverse osmosis is, what will happen if you have a salt water here, this portion is salt water, you want to have a good water or drinkable water is, they will be applying pressure at one side. What will happen? Due to this pressure, there will be a filter here, micro filter. If water is pressured in one side, after this filter, when the water goes, all the contaminants will be settled here and fresh water will come. This is called what? Reverse osmosis. If there is any fluoride problem in your place, you put a RO water there, you can drink that water, this problem will not come. Which of the following disease is caused by vibrio cholera? Cholera is B. Yes. Next one, the causative agent of typhoid fever is Salmonella typhi, which is A. Next one, hepatitis A virus is transmitted mainly due to hepatitis C. C is what? Contaminated water and food. Next one, which of the following is a protozoa waterborne diseases? They have told number of types: due to bacteria, due to virus, due to protozoa and parasite. I have told you. Giardiasis. Yes, B is the answer. Next one, which of the following can be prevented by vaccination? Yes, I have told vaccinations are above for all waterborne diseases. So, best way is to have vaccination at first. All of the above. Arsinosis is a chronic disease caused by A. A is drinking water contamination by arsenic. Next one, Minamata disease due to mercury. B is the answer. Yes. Next one, dental caries or tooth decay mainly occur due to A. A is called very high fluoride in water. Next one, which of the following pairing is correct? Mercury and Minamata disease. Yes. Arsenic poisoning in groundwater is a major problem in A. A is what? Rajasthan and West Bengal. Next one, which is the permissible limit of fluoride in drinking water as per BIS? BIS is Bureau of Indian Standards. 1.5 is the maximum limit. 1.5 is what? Maximum limit. Desirable. Desirable is, maximum is different, desirable is different. Desirable is less than that. Nalgonda technique is used for fluoride problem you are using. What is that? Defluoridation. Yes. Next one. Which of the following is a symptom of skeletal fluorosis? Skeletal is relevant to bones. So bone deformities.